Welcome to a special episode of the Pharma Forum podcast, sponsored by AOP Health. This is Pharma Forum web editor Nicole Raleigh, and in this episode I'll be speaking with Melissa Fellner, VP of Global Therapeutic Areas, Commercial Operations at AOP Health. A pleasure to speak with you today, Melissa.
Very nice to be here, Nicole. Thank you for having me.
So for 30 years, the AOP Health Group has been dedicated to developing innovative solutions to address unmet medical needs, particularly in the fields of rare diseases and intensive care medicine, and notably in cardiology and pulmonology, as well as haemato-oncology and advanced therapies. And today, Melissa and I will be discussing AOP Health's work in these areas, including the unique challenges faced in R&D in the rare disease space. To begin with, though, Melissa, perhaps you could describe your journey into life sciences and pharmaceuticals for listeners. What inspired you?
I think everyone has their story for what inspires them to work in medicine in one shape or another. And at the end of the day, we're all patients. For me, what inspired me to get into this line of work was actually when I was 8 years old, and my grandfather had a type of cancer that was quite devastating, and he did hospice care at home. And it was a whole year of me wondering, why is there no medicine that can fix him, that can help him, that can save him? And as he passed, I realized that's what I wanted to do with my life, is to work in developing medicines and bringing them to patients, to everyone, so we can really address these unmet needs.
Thank you, Melissa, and thank you for sharing your personal experience and this impetus driving you to find medicine to help. So let's now turn to the rare disease space, and in particular, research and development and the unique challenges that small patient numbers and indeed limited data present there. I was wondering if you could also share with us the challenges in comparison with other therapeutic areas.
There's a key word that you just mentioned that's really important here to set the scene for why rare diseases are a bit more challenging. And that is the word numbers, because there's a lot of scarcity in rare diseases. Scarcity is built into every aspect of the work. Scarcity of patients, of clinical data, of disease awareness, and often validated endpoints. Patient populations are small and geographically dispersed, which makes diagnosis, trial recruitment, and evidence generation more complex. Many rare diseases are also poorly understood with limited historical data, so teams are often building the scientific and clinical foundation at the same time as developing a therapy. There are only about 6,000 known rare diseases with a therapeutic solution available for only about 5% of these patients. And 70% of them begin in childhood. 72% of them have a genetic cause. And due to all of these factors, they're very hard to find. And it takes, on average, 5 years for a patient to be diagnosed with a rare disease.
Thank you, Melissa. I mean, it's incredible, that number. On average, 5 years it takes for diagnosis, as you say. So I was wondering here, Melissa, how can collaboration help, certainly in terms of the rare disease space?
Collaboration across the healthcare ecosystem is critical in rare diseases. I'd like to share an example from our AOP Health cardiology and pulmonary therapeutic area. We know that there's patients living with pulmonary arterial hypertension, which is a rare disease, and daily life is a challenge for them. Not only for those who are diagnosed, which can take many years, but also for the people who care for them. And to better understand these challenges, AOP Health, in cooperation with the Pulmonary Hypertension Association of Europe, conducted a multinational survey. We had patient organizations from 9 European countries come together. We ended up having over 600 people participate in this survey, including patients and their caregivers. The results showed us that people in different countries have different needs and challenges. and that there's actually very country-specific differences that we needed to take into account for how we best support these patients. So this effective engagement and support for patients with rare diseases across Europe requires more than one-size-fits-all measures. What we did was to create country-specific programs with services for doctors and patients to use that were tailored based on the unique needs of these patients in the countries, with education, with services, and care for both physical and mental well-being. We also included an online resource to help anyone concerned with PH to access and to also engage with others. And so this is a really great example of how collaboration in the industry is critical to find the right solutions beyond treatments for patients with rare diseases. I'd also like to share one more example that's an example of how clinical trial design comes out of industry collaborations. AOP Health is developing a new treatment in the oncology therapeutic area through a collaboration with Lucas Biotech at the Val d'Hebron University Hospital Institute. And this is based on research that was performed at the Josep Carreras Leukemia Research Institute. This compound that's come out of this collaboration targets and blocks a protein on the surface of cancer stem cells. And this may prove to be critical to treat the root cause of different types of cancers. Through our collaboration, we've initiated trials, and we already have a first-in-human trial that was developed, and we've started to enroll patients. And this represents a significant step towards understanding the safety and tolerability of the compound, and is a great example of how industry collaboration in rare diseases can identify potential solutions for patients.
Let's segue now to the vision of a landscape. And if we consider the treatment landscape, I was wondering if you could share with us how that has changed in the last 10 years, specifically when it comes to, as we've been discussing, rare diseases.
Over the last 10 years, the rare disease treatment landscape has fundamentally shifted. We've moved from largely supportive care to therapies that target the underlying biology of the disease. This results in a new focus on disease modification and potential remission for patients from these chronic diseases.
Thank you, Melissa. So are you able at all to go into further detail for us with regard to cell and gene therapies and AOP Health's work in this advanced therapy area?
AOP Health has over 30 years of experience in rare and complex diseases, and we recently started a partnership with RiaCell, an innovative stem cell company. Our partnership aims to commercialize a new stem cell technology and platform for severe immune and inflammatory diseases. One of the patients suffering from one of the diseases that we're exploring actually joined a team meeting recently with AOP Health team members, and he shared his personal experiences. It was very moving to meet someone suffering from a disease that we are urgently working to provide an innovative solution for. This experience and his story reinforces why we do what we do every day to urgently address unmet needs for patients suffering from rare diseases.
That's very inspiring. Thank you for sharing that, Melissa. So, in the rare disease treatment landscape, given everything we've been discussing, let's turn now to what the future might hold when it comes to technological innovation and advances in personalisation. I mean, we go from that notion of inspiring, just shared, to, I believe there's an excitement as to the future, is there not, Melissa?
There really is a lot of excitement. And for good reason. The future of rare disease treatment is being shaped by powerful technologies. Advances in genomics, gene and RNA therapies, cell-based approaches, artificial intelligence technologies, and increasingly sophisticated diagnostics so we can get to these diseases earlier. We're moving towards a world where treatments are more personalized, sometimes even tailored to very small patient groups or individual mutations. And at the same time, technology is improving how we run trials and collecting real-world data, which can supplement sometimes some of the trial information and data, so that we can also then better monitor outcomes and better understand diseases, the treatments that we're trying to address them through, and what really matters for patients.
Thank you, Melissa. So I have one final question for you today. If you had a key takeaway message for the entire rare disease community based on our conversation, what would it be?
My key takeaway would be this: progress in rare disease is real, but it only happens when we work together. Patients, families, researchers, clinicians, the industry, regulators, we all play a critical role. AOP Health is committed to do this and continue investing to understand the science behind rare diseases and develop new treatments for them. If we continue to collaborate openly, share knowledge, and keep patients at the center of every decision, we can turn scientific advances into meaningful outcomes, identify diseases that don't have a name yet, and develop treatments for them. Together, we can change the future for people living with rare diseases.
Thank you very much for your time today, Melissa. It's been a pleasure.
Thank you very much, Nicole. Pleasure's been all mine.
And that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for Pharma Forum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.